mind damaging a little bit. So, for example, you wouldn't want to use it on bowel, but it's particularly useful at holding edges of the vaginal vault or vaginal skin at a vaginal hysterectomy, but very commonly used to hold the vaginal vault after you have extracted or disconnected the uterus from the top of the vagina. You can also use it at a cesarean section to hold the peritoneum, for example, if you want to see into the pelvis. This is an atraumatic forceps, very different to the Littlewoods. They are quite traumatic, this with teeth. These are quite atraumatic. It's got very shallow transverse ridges, very commonly used to hold structures like the bowel, which you do not want to damage, or the fallopian tube when you're doing a tubectomy procedure where you can hold the tube gently but without damaging it and causing bleeding. So for the gynaecologists, particularly useful for tubectomies, removal of segments of fallopian tube, or to hold the bowel.
Are those Alice's? What are they?
Coming next to Alice forceps.
Is that right? Okay.
Yeah.
Shut up.
Which is a tissue forceps again, very secure tissue forceps with multiple teeth at the end, but quite traumatic, as you can see. Very useful to hold the rectus sheath, for example, while you're dissecting it from the underlying rectus muscle. You can use it to hold the vaginal vault, vaginal skin at repair surgeries. You wouldn't use this obviously on anything that you want to avoid damage, like the bowel or any other viscera like the bladder.
Sometimes people call those styles as well.
Styles, yeah.
Styles.
They come in different lengths as well. This is quite a long Alice tissue forceps. This is another tissue forceps, very strong and robust. Looks almost like a towel clip. They're called Lane's tissue forceps. Not a very elegant instrument, but increasingly used these days because of a problem with maternal or obesity among women. The commonest use is to hold the sheath and tie a ribbon gauze to it to secure the anterior flap of the incision out of the way if you're doing a transverse suprapubic incision, for example, but quite strong instrument with tooth. This is not an instrument which I do not use commonly, but some of my colleagues use. It is a hysterectomy clamp. What's the name again?
Called a Slade Ellis.
A Slade Ellis clamp, I am told, and it has got very similar ridges to a Vardyne, if you look at it. But the difference is that the instrument is very ergonomically curved. The advantage of these instruments, which have these double curve, is that particularly deep in pelvis, when you're operating, the instrument doesn't obscure your view. So if you have held tissue and you can visualize the tip standing superior to the instrument, and the handle and your hand is well out of your vision so that you can see what is at the tip. Particularly useful in confined spaces, like in deep pelvis or at a vaginal hysterectomy.
I think it also illustrates the point that there are lots of different clamps designed for uterine artery or for different roles. And I think in the exam, if you know the name of an instrument, say it. If you don't, if you're not sure of the name of the instrument, you could
describe it. Yeah.
Describe it. Just say what its features are and what you think it would be used for. They're not going to be giving marks for specific names for instruments. It's a bit like obstetric forceps. Yeah. How many sets of mid-cavity or axis traction forceps are there? You know, there was a time when every obstetrician did some minor tweak to the forceps so they could have their own name stuck on it.
Yeah. Surgeons like naming instruments.
They do. Names go down forever. And now, what we're going to do? Should we just swap the trolleys and then I don't need to move the camera?
Do you want me to put out the laparoscopic tray or not? Do you want to leave that?
If there are instruments on, we could. Well, let's just move that trolley aside and we'll move this trolley over, and we could put that on afterwards and see what treasures there are inside.
This is a cystoscope. A gynaecologist often performs cystoscopies, usually diagnostic cystoscopies.